Hi everyone, how are we doing? Still your one and only, the Niger Medical Police, Adamwalema. Yes, I said I would be back. We're going to analyze this case till the end. So when I called her and she now sent me the prescription and also sent me a video of the medication. So when I saw the medication, I saw it's this kind of medication that were poured into containers, And I asked her, what kind of medication is this? She said, ma, it's a compound drug. And immediately I decided to research what a compound drug is. And I found out that a compound drug in the context of the pharmacy refers to a medication that is created by a combination of two or more active ingredients, typically by a pharmacist, to meet the specific need of an individual and patient, And I also found out that the medications are not commercially available. You can't get it in a pharmacy. It is being produced to suit a particular patient, and are tailored to address a unique patient, like I said. So the moment I knew what a compound drug is, I tried to find out if it was really approved. And I found out that FDA, yes, I know FDA belongs to the American Food and Drug Association. They said they don't approve compound drugs. But I checked in Nigeria, since we're in Nigeria, and I found out that Pharmaceutical Council approves compound drug in Nigeria. I said, okay. So with that, I understood why it was difficult for her to read, because every drug has a leaflet that you can read and know the combination and know the side effects and know the dosage. So it was just a compound drug that they produced in UCH pharmacy, So I now try to find out why some patients need compound drugs. So I found out that most patients need compound drugs, maybe based on the fact that the medication that could treat that illness is not available. So they decide to produce theirs. I tried to find out the risk of compound drugs, and I found out that the risk of compound drug is that there might be too much or too little of the ingredients. And this can lead to serious patient injury and death. Then I also found out that most compound drugs are supposed to be stored in a particular temperature. And Nigeria, you know what it means. They might produce it and there's no light. Automatically, if it's not stored under a particular temperature that it should be, that means the drug will not be effective, or it can destroy something. The lady also told me that the son, after being given overdose of the compound drug for 17 days, she noticed that the son could not urinate for more than 12 hours. And it gave her concern, and she rushed back to the hospital. So I tried to find out if that captopril can actually affect the kidney. And the answer was yes, it can. So by so doing, it really damaged the kidney, and you know what the kidney does? It helps process all the waste. So the boy couldn't pass out the waste. You can understand what we're saying. Well, I'm going to share the prescription sheet, and I will share we'll still come back, we'll still analyze a lot about what happened. I still remain your one and only, the Niger Medical Police, Adamwalema. Cheers. Just hang in there and share our videos. Thank you so much.